You know, there's a quiet little issue that could be affecting the health and comfort of millions of folks over 70, right this very moment. It's not some new virus or a super rare disease. Nope, it's something much more common, often hiding in plain sight in our daily routines, sometimes just because we overlook it. Many seniors, maybe even you or someone dear to you, might unknowingly be risking some pretty serious infections, real discomfort, and a noticeable dip in their quality of life. And it often comes down to not properly cleaning three specific, really important areas of the body every day. Now, this isn't about needing a tough, full bath every single day, especially if that's become a bit of a challenge. We're talking about smart, focused hygiene that honestly becomes non-negotiable as our bodies change with age. Our skin gets thinner, our immune systems aren't quite the powerhouses they once were, and sometimes, just moving around can be tricky. These changes can create a perfect storm where small neglects can blow up into big health problems. We're talking about anything from annoying, persistent irritations to infections that can spread and need serious medical help, which can really knock your independence and vitality. Today, we're going to talk openly about these three often missed spots. We'll look at why they need your daily attention, particularly when you're over 70. And, most importantly, we'll share some easy, senior-friendly tips to help you or your loved ones stay healthy, feel good, and live comfortably for years to come. This isn't about scaring anyone, it's about giving you the knowledge to take control. The truth is, as we gracefully move past 70, our bodies go through lots of subtle, yet pretty significant, changes. These changes are totally natural, but they can make us a bit more vulnerable in ways we might not expect. Our skin, which is our body's first line of defense, tends to get thinner, more delicate, and not as oily, weakening its natural protective shield. At the same time, our immune systems, after fighting battles for us for decades, might not jump into action as quickly or as strongly as they used to. Add to that potential dips in mobility, flexibility, or even how well we feel things in certain parts of our body, and you can start to see why careful daily hygiene in specific areas isn't just a good idea, it's essential. Think for a second about all the tiny bacteria and fungi out there. They're everywhere, a normal part of our world. For most of our lives, a healthy immune system and good skin keep them from causing trouble. But in those warm, moist, and often covered parts of our body, they can find a perfect place to set up camp and multiply. If these spots aren't cleaned daily, things can get out of balance, and these microorganisms can really take over, leading to a whole host of problems. And we're not just talking about a little bit of body odor, though that can certainly affect how we feel about ourselves and interact with others. The risks are much more serious. Skin infections, like cellulitis or fungal infections, can start to develop. They might begin as just a simple itch or a red patch, but in an older adult, they can get worse quickly. The skin can break down, leading to painful sores, inflammation, and even ulcers that are tough to heal, especially if circulation isn't great, which can be the case for people with conditions like diabetes. Take the groin area, for instance. If it's not kept clean, especially if there are any issues with incontinence, it can lead to urinary tract infections. UTIs in seniors can be especially tricky because sometimes they show up with confusing symptoms like delirium instead of the usual pain, and they can quickly turn into kidney infections if they're not treated right away. Fungal infections, like candidiasis, just love these moist spots, causing intense itching, burning, and skin irritation. Then there are our feet. They've carried us through life, often cooped up in shoes, and that takes a toll. Reduced circulation and nerve sensation, which are common as we get older or with conditions like diabetes, mean that a small cut, a blister, or the start of a fungal infection might not even be noticed. Without daily washing and checking, these little issues can become open doors for serious infections, potentially leading to chronic wounds, difficulty walking, and in the worst cases, even amputation. I'm not saying this to frighten you, but to really highlight how important a seemingly simple daily task can be. The discomfort from these conditions is no small thing. It can mess with your sleep, make moving painful, and lead to a cycle of doing less, which then affects your overall health. It can mean more trips to the doctor, rounds of antibiotics or antifungal meds, and needing help from others for care, which can chip away at that precious independence. The emotional side, the frustration, the embarrassment, feeling unwell, that's a big deal too. That's why understanding which areas are most vulnerable and how to care for them properly is a key part of staying healthy and full of life after 70. It's about stopping these easily avoidable problems and holding on to the joy and freedom this chapter of life should bring. The 3 critical body parts. The great news is that protecting your health from these common yet impactful issues doesn't require some massive effort. It just needs focused attention on 3 specific areas that, because of how they're made and how our bodies change with age, become hotspots for potential trouble. By bringing some simple, gentle, yet thorough daily cleaning into your routine for these zones, you can seriously cut down your risk of infections, discomfort, and other related complications. So, let's get into these 3 critical body parts, understand the specific risks for each, and look at some easy, senior-friendly ways to keep them healthy. Section 1. The first critical body part, armpits. Our armpits, or axillae, if you want to get medical about it, are one of those spots we often clean on autopilot, right? A quick swipe with a soapy washcloth in the shower, and we figure we're done. But, especially after 70, this area really does need a bit more careful attention because of its unique environment and how our skin changes. The problem and risk specific to armpits after 70. Armpits are naturally warm and often damp because of all the sweat glands packed in there. This makes them a perfect hangout for bacteria. While sweat itself doesn't really smell, it's the bacteria breaking it down that causes body odor. But it's not just about odor, these bacteria multiplying can lead to bigger issues. As we age, our skin often gets thinner, more delicate, and sometimes drier, even in sweaty spots. This increased fragility means armpit skin is more easily irritated by friction and by what bacteria leave behind. Small scrapes or chafing can quickly become entry points for infection. You might see things like intertrigo, which is an inflammation in skin folds, causing redness, itching, and sometimes a rash that weeps. Fungal infections can also grab hold in that warm, moist armpit environment. Plus, some deodorants or antiperspirants that you've used for years might suddenly start causing irritation as your skin sensitivity changes. If product residue isn't washed away daily, it can also clog pores and cause inflammation. Forgetting to clean this area well or not drying it properly can make all these risks worse, leading to ongoing discomfort and skin infections that are harder to deal with in older adults because healing can be slower. The daily impact of armpit neglect. Just imagine that constant itch or burning feeling under your arms. It can make simple things like raising your arms, getting dressed, or even hugging someone you love uncomfortable. If a rash or an infection develops, it can cause soreness and tenderness that messes with your daily activities and your sleep. Body odor, while a common worry, can also get stronger if hygiene is skipped, possibly making you feel self-conscious and less like socializing. This isn't just about physical discomfort, it's about how these seemingly small issues can hit your confidence and general sense of well-being. If an infection really takes hold, you might need to see a doctor, get special creams, or even take oral antibiotics, which is an unwelcome hassle. Think about Mrs. Allen, a lively 75-year-old who started getting a persistent rash and itch in her armpits. She'd always been careful about her hygiene but hadn't realized her usual quick wash wasn't quite cutting it as her skin had become more sensitive. Her doctor explained that the mix of moisture, bacteria, and her slightly more delicate skin meant she needed a gentler, more thorough approach to daily cleaning and drying. Senior-friendly cleaning tips for healthy armpits. Keeping your armpits healthy is pretty straightforward with a few dedicated steps. 1. Daily cleansing is key. Make this a must-do part of your daily routine, even if you're not having a full shower or bath. A sponge bath focusing on key areas works great. 2. Use warm water and mild soap. Hot water can strip your skin of its natural oils, leading to dryness and irritation, so go for lukewarm water. Pick a gentle, fragrance-free, and pH-balanced soap or cleanser. Harsh or heavily scented soaps can mess with your skin's natural barrier and cause irritation, especially on sensitive older skin. 3. Gentle washing technique. Use a soft washcloth, a gentle sponge, or just your hands. No need for vigorous scrubbing, that can damage the delicate skin in your armpits. Clean the whole armpit, including any skin folds, using gentle, circular motions. 4. Rinse thoroughly. Make sure all the soap is rinsed away, as leftover soap can be irritating. 5. Dry completely. This step is super important. Pat the area dry with a clean, soft towel. Don't rub, as that can cause friction and irritation. Make sure the armpit is totally dry, because moisture is a breeding ground for bacteria and fungi. If you have skin folds, gently lift them to ensure the skin underneath is also dry. Some people find using a hairdryer on a cool setting, held at a distance, can be helpful, especially if mobility is an issue. 6. Think about your deodorant/antiperspirant. If you use one, choose a product made for sensitive skin, ideally fragrance-free and alcohol-free. Apply it to completely dry skin. If you notice any irritation, stop using it and try a different one, or talk to your doctor. 7. Let skin breathe. Whenever you can, wear loose-fitting clothes made from natural, breathable fabrics like cotton. This helps cut down on moisture buildup and friction. By adding these simple steps to your daily hygiene, you can really lower the risk of odor, irritation, and infections in your armpits, helping you feel fresh, comfortable, and confident every day. Section 2, the second critical body part, groin/genital area. The groin and genital area, sometimes called the perineal area, is definitely one of the most critical regions to keep clean with daily hygiene, especially as we get older. Because of its anatomy and what it does, it's naturally prone to moisture, bacterial growth, and fungal infections. For seniors, several age-related changes and potential health conditions can make these risks even bigger, making careful daily care absolutely vital for comfort, health, and dignity. The problem/risk specific to the groin/genital area after 70. This area is naturally warm and moist, which, as we know, creates an environment where tiny organisms can thrive. Several things specific to aging can make this region more vulnerable. Skin changes. Just like other parts of the body, the skin in the groin area gets thinner, less elastic, and more likely to tear or get irritated as we age. The skin's natural acidic protection, which helps guard against infection, can also be weaker. Reduced immune function. A less powerful immune system means the body isn't as good at fighting off potential infections, whether they're bacterial or fungal. Incontinence, even slight urinary or fecal incontinence, which can become more common with age due to various body changes, significantly bumps up the risk of skin irritation, breakdown, and infections like UTIs. Constant exposure to moisture and irritants from urine or feces can quickly damage delicate skin. Mobility issues, trouble with bending, reaching, or standing can make cleaning the genital area thoroughly a real challenge, sometimes leading to unintentional neglect. Catheter use. For anyone using a urinary catheter, the risk of UTIs and local skin irritation is much higher, requiring even stricter hygiene. The fallout from not keeping this area clean enough can be serious. Urinary tract infections are a big worry, especially for women because their urethra is shorter. Symptoms can include pain, burning, needing to pee often, and in seniors, can sometimes show up as confusion or agitation. Fungal infections, often yeast infections, love warm, damp skin folds, causing intense itching, redness, and a typical rash. Bacterial skin infections can also pop up, leading to soreness, inflammation, and possibly painful sores or abscesses. Skin breakdown, from minor chafing to more serious pressure sores, is a major risk, causing a lot of pain and needing careful wound care. Agitation, the far-reaching impact of neglect in the groin area. The discomfort that comes with problems in the groin area can really throw a wrench in your life. Persistent itching or burning can make it hard to sit comfortably, walk, or get a good night's sleep. The pain from skin breakdown or a UTI can be truly debilitating. Consider Mr. Davis, an 80-year-old widower. Arthritis in his hips made it increasingly difficult for him to clean himself properly. He ended up with a recurring fungal rash that caused him huge distress and embarrassment, and he started avoiding social events. His daughter gently helped him find some adaptive tools and a routine that allowed him to manage his hygiene better, which brought back his comfort and confidence. Beyond the physical symptoms, there's the emotional side. Issues in this private area can lead to feelings of shame, a loss of dignity, and social isolation. Needing medical help, whether it's antibiotics for a UTI or antifungal creams for a rash, adds another layer of stress and bother. For those dealing with incontinence, the fear of odor or leakage can be a constant source of anxiety. Neglecting this area isn't just about cleanliness, it's about preventing a whole cascade of physical and emotional distress that can seriously reduce your quality of life. Solution: senior-friendly cleaning tips for a healthy groin/genital area. Keeping this sensitive area clean needs a gentle yet thorough touch. 1. Daily cleansing is a must. This area needs to be cleaned at least once a day, and more often if incontinence is an issue. 2. Use warm water and mild, unscented soap, like with armpits. Steer clear of harsh, perfumed soaps, bubble baths, or feminine hygiene sprays. These can irritate delicate skin and mess with the natural pH balance. A mild, pH-neutral, fragrance-free cleanser is your best bet. 3. Gentle washing technique. Use a soft washcloth, a dedicated sponge, or your hands. For women, always wipe and wash from front to back. This is so important to stop bacteria from the anal area from getting into the urethra and causing UTIs. Clean the external labia and the perineal area. It's generally not necessary to clean inside the vagina, as it has its own self-cleaning system. Douching can actually disrupt this natural balance. For men, gently wash the penis and scrotum. If you're uncircumcised, gently pull back the foreskin and clean underneath, then rinse and gently return the foreskin to its normal position. Clean the perineal area too. 4. Cleanse skin folds. Pay special attention to any skin folds in the groin area, as moisture and bacteria can collect there. Gently separate folds to clean and rinse well. 5. Rinse thoroughly. Make sure all soap is rinsed off to prevent irritation. 6. Dry meticulously. This is a really critical step. Gently pat the entire area dry with a clean, soft towel. Don't rub. Make sure all skin folds are completely dry. Lingering moisture is a major cause of fungal infections and skin irritation. A hairdryer on a cool setting, held at a safe distance, can be very helpful, especially if reaching or thorough towel drying is difficult. 7. Incontinence care. If you're using incontinence pads or briefs, change them often, as soon as they get wet or soiled. Cleanse the skin thoroughly with each change using gentle wipes designed for sensitive skin or a soft cloth with mild cleanser and water, then pat dry. Apply a barrier cream if your doctor or nurse recommends it, to protect the skin from moisture and irritation. 8. Wear breathable underwear. Choose underwear made from breathable fabrics like cotton. Avoid tight-fitting synthetic materials that can trap heat and moisture. Change your underwear daily, or more often if it gets damp. 9. Stay hydrated. Drinking plenty of water can help dilute urine, making it less likely to irritate the skin, and can also help prevent UTIs. 10. Seek medical advice if needed. If you notice any persistent redness, itching, rash, sores, unusual discharge, or symptoms of a UTI, don't wait, see your doctor. By carefully following these steps, seniors can massively reduce the risk of infections and discomfort in the groin and genital area, protecting their health, dignity, and overall well-being. It's a vital part of self-care that really pays off in comfort and health. Section 3, the third critical body part, feet. Our feet, they're the unsung heroes of our bodies, aren't they? Carrying us through a lifetime of steps, adventures, and everyday moments. Yet, they often get overlooked when it comes to daily hygiene, especially as we get older. For folks over 70, taking good care of your feet every day isn't just about being clean or looking nice, it's a super important practice for preventing serious health issues, staying mobile, and making sure you feel good overall. The problem/risk specific to feet after 70. Several age-related changes and common health conditions come together to make feet especially vulnerable in later life. Reduced circulation. Blood flow to our hands and feet can slow down with age or due to conditions like peripheral artery disease. Poor circulation means healing slows right down, so even small cuts, blisters, or sores can take much longer to heal and are more likely to get infected. Decreased sensation kisses. Things like diabetes or even just normal aging can lead to less nerve sensation in the feet. This means you might not feel a little stone in your shoe, a blister forming, or a cut, allowing these problems to get worse without you even knowing. Skin changes. The skin on our feet can get drier, thinner, and more likely to crack as we age. Cracked heels or dry skin can become open doors for bacteria and fungi. Toenails can also get thicker, more brittle, and harder to look after, sometimes leading to ingrown toenails or fungal nail infections. Fungal infections. Feet are often stuck inside shoes and socks, creating a warm, dark, and moist environment, basically a paradise for fungi like the ones that cause athlete's foot or fungal nail infections. These infections can cause itching, scaling, redness, and make nails discolored and thick. Mobility and flexibility issues. If it's hard to bend down to reach or see your feet, it can make proper washing, drying, and checking them a real challenge. This can lead to not cleaning them well enough, especially between the toes, or missing emerging problems. Chronic conditions. Seniors with diabetes are at an especially high risk for foot complications. Diabetic neuropathy and poor circulation can turn a minor foot issue into a severe infection or ulcer that, in the worst situations, could even lead to amputation. Arthritis can also make foot care tricky and can contribute to foot deformities that create more pressure points. The risks of not looking after your foot hygiene are pretty big. Fungal infections can spread and be really tough to get rid of. Bacterial infections can sneak in through tiny breaks in the skin, potentially leading to cellulitis. Untreated sores or ulcers can become chronic, painful, and severely limit your ability to get around. For anyone with diabetes, these risks are multiplied many times over. Agitation, the price of foot neglect, mobility and independence at stake. Imagine if the simple act of walking became painful. That's the reality for many seniors who develop foot problems because of neglect. An untreated ingrown toenail can make every single step agony. Athlete's foot can cause non-stop itching and burning. A small, unnoticed sore can get infected and become an open wound that just won't heal, making it impossible to wear shoes and restricting your movement. This loss of mobility isn't just a physical limit, it's a real hit to your independence. It can mean not being able to go for walks, run errands, join in social activities, or even move around your own home comfortably. Think about George, a 78-year-old retired postman who always loved his daily walks. He started noticing his feet were often itchy and the skin between his toes was peeling. Because his back was stiff, he found it hard to dry them properly. He developed a stubborn case of athlete's foot, which then led to a secondary bacterial infection from scratching. It took weeks of treatment and really careful attention to his foot hygiene, with help from a long-handled sponge and a commitment to thorough drying, before he could comfortably get back to his beloved walks. The cycle of pain, infection, and reduced mobility can lead to a more sedentary lifestyle, which then can contribute to other health problems. The health of our feet is so closely tied to our ability to stay active, independent, and engaged with life. Solution: senior-friendly cleaning tips for healthy feet. Protecting your feet needs a consistent daily routine. 1. Daily washing. Wash your feet every day, even if you don't take a full bath or shower. 2. Use warm water and mild soap. Hot water can dry out the skin. Use lukewarm water and a gentle, non-irritating soap. Avoid harsh soaps that can strip away natural oils. 3. Clean thoroughly, including between toes. Use a soft washcloth or sponge to gently clean all over your feet. Pay special attention to the spaces between your toes, where moisture and fungi love to gather. If reaching is tough, a long-handled sponge or brush can be a lifesaver. 4. Rinse well. Make sure all soap residue is rinsed off, as it can be drying or irritating if left on the skin. 5. Dry meticulously, especially between toes. This is one of the absolute most important steps. Moisture left between the toes is a top cause of fungal infections. Gently pat your feet dry with a clean, soft towel. Take extra care to dry thoroughly between each toe. You might use the corner of the towel or a separate small, thin towel for this. If you have trouble reaching, a hairdryer on a cool setting can work really well. 6. Daily inspection. While you're drying your feet, or at another good time each day, check them carefully. Look for any cuts, blisters, sores, redness, swelling, calluses, corns, cracks in the skin, or changes in nail color or texture. If you can't see the bottoms of your feet easily, use a long-handled mirror or ask a family member or caregiver to help. Catching problems early is key. 7. Moisturize kisses. If your skin is dry, apply a good quality, fragrance-free moisturizing cream or lotion to the tops and bottoms of your feet to prevent cracking. However, do not put moisturizer between your toes, as this can create too much moisture and encourage fungal growth. 8. Proper nail care. Cut toenails straight across, and not too short, to prevent ingrown toenails. If your toenails are thick, difficult to cut, or if you have diabetes or poor circulation, it's best to have them trimmed by a podiatrist or a healthcare professional trained in foot care. Keep nails clean, scrubbing gently underneath them if you need to. 9. Wear clean socks and proper footwear. Wear clean socks made of breathable materials every day. Change them if they get damp. Choose well-fitting, comfortable shoes that give good support and don't rub or pinch. Try to avoid going barefoot, especially if you have reduced sensation, to protect your feet from injury. 10. Seek professional help. If you notice any changes that worry you, like a sore that isn't healing, signs of infection, persistent pain, or big changes in your nails, see your doctor or a podiatrist right away. Daily foot care after 70 is truly an investment in your mobility, independence, and overall health. These simple steps can make a huge difference in preventing painful and potentially serious foot problems. While we've really zeroed in on the critical trio of armpits, the groin area, and feet, and for very good reasons, it's good to remember that these specific routines are part of a bigger picture of overall personal hygiene. Keeping clean all over contributes so much to health, comfort, and dignity, especially as we get into our later years. Letting other areas slide can also lead to discomfort or increase the risk of spreading germs. Let's quickly mention a few other areas that also benefit from regular, thoughtful attention. Hands and fingernails. Our hands are constantly touching the world around us, picking up and possibly passing on germs. Washing your hands often and thoroughly with soap and water for at least 20 seconds is one of the best ways to stop infections from spreading. This is especially vital before eating, after using the toilet, after coughing or sneezing, and after being out in public. Fingernails can hide dirt and bacteria, so keeping them trimmed short and cleaning underneath them regularly is also a smart move. Oral hygiene. Good oral hygiene is so important. Brushing at least twice a day with fluoride toothpaste and flossing daily helps prevent tooth decay, gum disease, and bad breath. Poor oral health isn't just about your teeth, it can be linked to other health issues in your body, including heart problems. Regular dental checkups are a must. If you wear dentures, they need to be cleaned thoroughly every day and taken out at night, just as your dentist advises. Skin folds and belly button, any spot where skin touches skin can trap moisture and warmth, creating a potential breeding ground for bacteria and fungi. This includes folds under the breasts, on the abdomen, or in the neck. These areas should be gently washed and, crucially, dried thoroughly each day. The belly button, especially if it's an innie, can also collect gunk and moisture and should be cleaned gently with a soapy washcloth or cotton swab and then dried. Hair and scalp care, washing your hair regularly with a mild shampoo helps keep your scalp healthy and your hair clean. How often will depend on your individual needs and hair type, but making sure your scalp is clean helps prevent issues like dandruff or irritation. Beyond these specific areas, here are some general practical tips to make daily hygiene routines easier, safer, and more effective for seniors. Adapt bathing frequency and methods. A full bath or shower every single day might not be necessary or even the best idea for all seniors, as it can dry out the skin. However, as we've stressed, daily spot cleaning of the armpits, groin, and feet is absolutely key. Sponge baths can be a fantastic alternative on days when a full shower isn't happening, letting you clean these critical areas without the effort or risk of a full shower. Choose gentle products, go for mild, fragrance-free, pH-balanced soaps and cleansers to keep the risk of skin irritation and dryness low. Moisturizing soaps can be helpful. Use assistive devices. If mobility, balance, or reach are tricky, don't hesitate to use assistive devices. Long-handled sponges or brushes can help you reach your back and feet. Shower chairs or benches can make showering safer and less tiring. Grab bars in the shower and near the toilet are essential safety features to prevent falls. Ensure bathroom safety. Keep the bathroom well lit. Use non-slip mats in the tub or shower and on the bathroom floor. Make sure the water temperature is warm, not hot, as sensation can lessen with age, increasing the risk of burns. Monitor skin regularly. Daily cleaning routines are a perfect chance to check your skin for any changes, redness, rashes, sores, new moles, or bruises. Catching any skin issues early allows for quick treatment. Maintain dignity and comfort. Personal hygiene is a very private thing. If help is needed from a caregiver or family member, it's so important to approach it with sensitivity, respect, and clear communication to preserve the person's dignity and comfort. Letting the senior do as much as they can for themselves is empowering. Launder regularly. Regularly wash towels, washcloths, undergarments, and bed linens to keep things hygienic and prevent bacteria and odors from building up. By thinking about these broader aspects of hygiene and using these practical tips, seniors can create a complete self-care plan that supports their health, boosts their comfort, and lets them keep living with confidence and energy. So, to quickly sum things up, the 3 critical body parts that absolutely need daily cleaning, especially after you turn 70, are your armpits, your groin and genital area, and your feet. Overlooking these spots can lead to a whole bunch of preventable problems, from odor and discomfort to serious skin infections, UTIs, and issues with getting around. Remember, gentle, thorough cleaning with mild products, followed by careful drying, is the main thing for good hygiene in these sensitive zones. If you found this information helpful and you're looking for more tips on staying healthy and vibrant as you age, why not subscribe to our channel? We're all about providing practical, expert-backed advice for seniors. We'd also love to hear from you in the comments below. Which of these hygiene tips was new to you, or do you have any of your own senior-friendly hygiene tips to share with our community? Your ideas are so valuable. And if you're interested in learning more about staying well overall, be sure to check out our other video on taking a few extra minutes each day to consciously and carefully clean your armpits, groin area, and feet isn't just about personal freshness, it's a really meaningful act of self-care and a powerful step towards protecting your health, comfort, and independence, particularly after 70. These simple, targeted hygiene practices can hugely reduce your risk of painful infections and uncomfortable problems, letting you focus on living your life to the fullest. It's about empowering yourself with the knowledge to make small changes that can make a big difference in your overall well-being. Remember, your health is your most valuable asset. By embracing these easy-to-do strategies, you're investing in your vitality, preserving your dignity, and making sure you can continue to enjoy every precious moment with energy and confidence. Stay clean, stay healthy, and stay vibrant.